Now, what are the advantages of doing this? Very important, because they have less pain after operation. It is very important. They have less blood loss, which is also even more important, because you should not be giving blood transfusions in patients with cancer, because it affects their outcomes. So less blood loss is important. Shorter hospital stay. So that is also even more important, because nowadays everything is expensive. So if you stay longer in the hospital, you pay more money. So shorter hospital stay, which is very important. Another important thing is low conversion rate to open surgery. Because this is a very advanced thing, you will find that if you go in some difficult cases, not in all, but in difficult cases, you will find that if you go with the video assisted surgery, there is a high chance you will have to convert to open, but not with the robot. The conversion rate is much low. And low complication rates. Patients spend much less time in the ICU or in the high dependency and in the hospital. We can do everything in the chest with the robot. So this is an example of esophageal surgery. All of you must have heard of esophagus and esophageal cancer, which is a very, very difficult operation, but with the robot, you can do that safely. As you can see here, this is the huge esophageal tumor here. And this patient was a young patient. And this was not esophageal cancer, but it was a benign tumor. So which makes it even more important that we operate this through minimally invasive surgery so that the patient can get back to normal life as soon as possible. Even though these surgeries may take a little bit longer time, you will find that the patient goes home much faster. And that here is that is my second arm. So you can see all that I have 3 extra arms and 1 my camera. So I've just developed more powers than God gave me. That is because of modern technology, okay? So the robotic platform gives you all these big advantages, even for very difficult cases like the esophageal surgery, okay? You will find that this huge esophageal tumor, we can still take out by doing through keyhole. This takes a little bit more precision. You will find that, I understand this is for public, so I will cut short the gore, but then you can see that we do remove it. Nicely, it will come out, and then it's like any test. We put a raw scope and see whether there's any leak. There is no leak. It is fine, and all the tumor is out and in the bag. Okay, so you can do esophagus. What else can you do in the chest with the robot? We can do a lot of things. There are some areas which has got difficult tumors, where tumors are sitting in very difficult positions. And I think robot is the best to work with it. This is called a nervous tumor from the nerve tissue. And this is the aorta, which is the most important blood vessel in your whole body. Okay, it's called the aorta. So you can see that this tumor is sitting between the lung and the aorta. In spite of such tricky things, because the robot is so precise, we are able to operate on such a difficult case, and then can take it out quite safely. So in spite of that, you see that with the robot, we can actually take a piece of the covering of the heart with the robot, okay? And it is quite safe too, okay? All this can be done through small cuts. So there is the heart beating away, You've taken all this disease which covers outside the heart and it is coming out. To manage any robotic program, you need me. This is me. And then you need an oncologist who specializes in lung cancer or thymic cancer. Then you need a lung physician, pulmonologist. So we work together all the time. And then to diagnose what it is, you need a pathologist.
Masih telah menonton video ini, jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.